Anesthesiology has always been a specialized posting, and a little importance has been given to it during medical school education. The intensive care unit, on the other hand, is always the scariest place to go for the new graduate. Unfortunately, these are the two best places for learning of basic medicine and resuscitation. By incorporating anesthesiology and intensive care rotation in the housemanship training, it is hoped that the house officer will have a better insight and understanding of the holistic management of the patients, especially the critically ill ones. Here we will be learning the functions of the department, the team players in this department, how time can be managed well while training in this department, the roles and responsibilities of a house officer in the Department of Anesthesiology, the expectations of being a house officer here, and last but not least, the pathway to specialize in this field for those of you who might be interested to understand the journey or maybe live one. Let's get started. Anesthetic training after World War II from 1945 was basically a postgraduate clinical apprenticeship for medical officers to give gas for surgical operative procedures performed in the Ministry of Health Service hospitals. Surgical housemanship training included learning endotracheal intubation and administering basic inhalational general anesthesia. And very few medical officers chose to take up anesthesia as a clinical specialist career. Today, postgraduate teaching and training in anesthesiology brought in new concepts in the 1980s and 1990s and opened up new awareness for the clinical contributory roles of the anesthesiologist. The changing image of the anesthesiologist as a physician or surgeon based clinical specialist playing a crucial role in the team management of the unconscious and the critically ill emerged. Anesthesia for surgery became perioperative care, which is pre, intra, and post anesthesia, essentially involved in patient care safety and pain relief. So, anesthesiology is the medical specialty concerned with the total perioperative care of patients, where it is before, during, and after surgery. The core element of the specialty is the study and use of anesthesia to safely support a patient's vital functions through the perioperative period. It encompasses the anesthesia, intensive care medicine, critical emergency medicine, and pain medicine. The specialist here is known as the anesthesiologist or the anesthetist. The anesthesiologists are doctors who are trained to administer and manage anesthesia given during a surgical procedure. The anesthesiologist's expertise in airway and support and cardiopulmonary resuscitation contributed to the development of resuscitation, which is the care of the acute unconscious. The anesthesiologist's expertise in monitoring and supporting the vital systems, such as mechanically and pharmacologically, led to the development of the concept of intensive care, which is caring for the prolonged unconscious. So there are numerous staff and service providers working together in the anesthesiology department to ensure the objectives of the departments are met. It is advisable to be well aware of who your team comprises and what are their respective roles as part of the anesthesiology team. Let's begin with the head of department. The department head usually holds a post of a consultant. The HOD runs the department, essentially looking into the financial needs, resource needs, and overseeing the day-to-day activity of the department. The HOD is assigned to ensure that the department is running smoothly. They also play an important role as a representative of the department to important meetings, raising issues to the attention of the hospital director, and managing the department's budget to ensure adequate medications and equipment are available. They are expected to be enthusiastic in research arena of their field to drive development and advancement. Then we have the consultants. So in hospitals with intensivist, who is an anesthetist who has subspecialized in intensive care, plays a role as a consultant in the ICU. They conduct ward rounds daily, looking into the most detailed matter of the patient. They specialize in striking a homeostatic balance of the organs and systems in the body while the patient is kept sedated and ventilated. They also guide fellow anesthetists in the ICU and troubleshoot difficult problems. An anesthesiologist is actually a perioperative physician, where peri means all around. So, an anesthesiologist is responsible for patient care throughout the surgical experience, before, during, and after the surgery itself. The anesthetist will be your assessors at the end of your posting, and they will also supervise teaching and CME sessions. Then we have the medical officers. The medical officers in the ICU is your one up who reviews the patient with you before the specialist arrives. The cooperation between the medical officers, house officers, and the ICU nurses is essential in ensuring patients receive holistic care during their stay in the ward. It is advisable that the house officer brings forth any setbacks pertaining patient care or management that he or she may face to the medical officer in the ICU. Next, we have the nursing staff. Let's begin with the matron. Matrons are in charge of the nursing service division, and they are directly accountable for the proper organization, direction, and coordination of nursing services. Then we have the ICU sister or the OT sister. The ICU or the OT sister organizes all nursing activities of a unit in accordance with hospital's policies and rules. The sister also directly supervises patient care of the unit and provides direct care to seriously ill patients as and when a situation arises. She takes care of the well-being of the nursing staff team. She manages and arranges the rosters for the nursing staff team and also helps the nurses carry out their duties if the wards become too busy or overwhelming. She's in charge of ensuring all the records of the patient related to diagnosis, condition, and treatment, and ensure proper maintenance of the records. Then we have the staff nurses. In the ICU, it is typically a one-to-one care or one-to-two care, which refers to one nurse to one or two patients. This is highly specialized in order not to miss any rapid change clinically and biochemically affecting the patient, as the patient won't be able to show signs or describe symptoms. They closely watch over these patients and promptly respond to unexpected changes or changes going beyond acceptable range set by the intensivist in the ICU. Like every other department, their main tasks include positioning of patient, suctioning, administering medications, and feeding, as well as blood sampling for testing. Next, we have the allied health professionals, who are the pharmacists. So the ICU pharmacists dispense medications and also provide counseling to patients and family members. They provide their consultation on the safety of the therapeutics prescribed, alternative drug therapy, double checking on dosages, and orders to prevent medication errors. They also provide suggestions to manage the current medication supply available in the hospital. Next, we have the support staff, who are the clinical assistants and the lab assistants. So the clinical assistants are involved in a range of duties associated with the upkeep of the ICU environment, cleaning medical devices, and maintaining the highest standards of cleanliness throughout. They are also responsible for giving out meals and drinks to patients and ensuring the menu choices are completed and communicated to the appropriate unit. Then we have the lab assistants, who actually assist the physicians as well as the anesthetist in the diagnosis and treatment of diseases by performing tests on tissues, blood, and other body fluids. Then we have the imagers, also known as radiographers, who are certified technicians who capture images of organs, bones, and tissue for patient diagnosis. Radiographers are equipped with the technological skills to handle imaging equipment and the interpersonal skills necessary for patient care. As for the record keepers, they are important in maintaining the medical records. They must safeguard medical records from tampering, loss, and unauthorized use. They are responsible for seeing that the patient's rights to privacy and the confidentiality of the information stored within the medical record is maintained at all times. Now, let's quickly take a look at the roles and responsibilities of the house officer in this department. So, we have the pain clinic, the emergency room, the wards, and the operation theatre. So, in your rotation in the anesthesiology department, you will be placed in the pain clinic assisting your medical officer, as well as the specialist who's in charge of the pain clinic, in reviewing new cases, reviewing follow up cases, as well as assisting with minor tests or procedures. As for emergency room cases, you will be accompanying your medical officer and the anesthetist to clock the new cases referred by the resuscitation zone. Assessment is required and proper documentation will highlight the main issues and criteria for admission to the ICU or not. Commonly, you will also encounter referrals from the wards. So you will be accompanying your medical officer in attending to referrals for acute resuscitation or intubation and admission to the ICU unit. And finally, from the operating theatre. So patients from the operating theatre who may require continuous critical care monitoring post-surgery will be admitted to the ICU. And here, it will be important for you to not only prepare the patient prior to the surgery if you're in charge of the anesthetic team in the OT, and if you're in charge in the ICU, taking a passover from your colleague from the OT will be important, as here you will be needing to document the entire progress of the patient until admission to the ICU. So as mentioned earlier on, your roles will include reviewing the patient, clocking cases, carrying out procedures that are specialized in the ICU as well as the OT, ordering tests, getting referrals done, preparing the discharge and transfer summaries, and finally, if there's a need for resuscitation, to carry it out promptly. Now, time management is extremely crucial to reap the maximum benefit of training during housemanship. So let's look at a few general tips on how you could organize your tasks and use them wisely. Tip number 1 is to create a job list. So make a customized table to summarize your ward works as well as your ICU and OT work systematically. Prioritize work that needs to be done within office hours. Cross out the tasks that had been carried out to avoid confusion between colleagues and delegate the task among you and your colleagues to finish them quick. Familiarize with your patients and their surroundings. So get to know your patients well as their surroundings. So you may want to allocate at least 10 to 15 minutes to review your patients' cases if they were primed for surgery or if they are admitted to the ICU. Remember the important things about your patients and the significant results, as well as save the necessary emergency contact information for the day, such as the anesthetist on call or the medical officer or registrar on call. As here in Malaysia, we do not use a pager system. Next will be taking turns with your colleagues if you wish to take a break, and notify your team members or senior colleagues on your whereabouts to ensure miscommunication is avoided. If you're working in the OT on that particular day, make sure you have your breakfast first, as you may not know how long or if the operation you need to assist may be prolonged. Be early to reconfirm your patient's cases, which have been scheduled for elective or sometimes emergency OT as well. And finally, use electronic or digital productivity tools, which most of you might already have in your daily usage devices such as your smartphones, iPads, or a digital notepad. Utilizing the reminder, notifications, and planner apps or systems can not only save your time, but also ensures tasks are completed. Apart from that, you do not need to worry about documentation, as you can always refer to the information or case taught previously. Now, what is expected out of you as a house officer in this department? Well, here you will be in the operating theatre for long hours depending on the nature and duration of the surgery. So you might be needing to prepare yourself for the cold environment in the operating theatre. Also, in this department, you will be trained to perform highly specialized skills such as central line insertion, endotracheal intubation, spinal anesthesia, laryngeal mask airway insertion, and many more. So you have to be prepared for these procedures prior to encountering them in real life. Next, you'll be needing to think on your feet because rapid response is required as you are part of the resuscitative team in the operating theatre, in the ICU, as well as attending to cases in the wards from the cases referred. Finally, many patients in the ICU might succumb to their illness or disease. So here, breaking bad news to the family members is an important role that you play as a team member in the ICU department. Now, as you progress through this specialty, you find yourself having an interest in this field and plan to specialize in it. So, how do you go about it? The training pathway can be divided into master's training, which is open to both MOH and MOE applicants. The MOE applicants can apply through the university's website. The MOH applicant can apply through the HLP. This course will be fully supported by the Ministry of Health through scholarships or paid leave granted to applicants for the whole duration of the program. The other pathway is the FRCAI Parallel Pathway Training. The entry requirement to the MCAI MCQ examination is a minimum of 6 months anesthesia experience obtained post-housemanship in any anesthesia specialist-based hospital and has acquired full registration with the Malaysian Medical Council MMC. This is followed by training based in regional or accredited hospitals recognized by the College of Anaesthetists of Ireland for another 6 months for the trainee to be eligible to sit for MCAI or SCI or SOE examinations. The entry requirement to the FCAI examination is a minimum of 36 months anesthesia experience with 30 months based in regional or accredited hospitals. Upon passing the FCAI examination, the trainee will continue with a structured 3 years competency training program subject to close supervision. During these 3 years, trainees will undergo formal assessments and are expected to record their clinical practice and academic activities in the logbook. Progression through these 3 years will depend upon achieving essential competencies, and these will be reviewed through formal supervisors' reports by appointed supervisors of training and head of departments. This is the list of recognized postgraduate qualifications in Malaysia for the Anaesthesiology department. These are the local and overseas programs that are recognized postgraduate qualifications to practice as a registered anesthetist in Malaysia. You may find this list on the Malaysian National Specialist Registry website. So let's look at some subspecialties in anesthesiology. So one can then proceed further to subspecialize in cardiothoracic anesthetists, intensive care, neuroanesthesiology, obstetric anesthesiology, pediatrics anesthesiology, pre-hospital care and trauma care, acute or chronic pain medicine, as well as regional anesthesiology. So in summary, we have looked at what does this department essentially deal with, who are the essential team players that make this department, simple tips on how time can be managed well while training in this department, understanding roles and responsibilities of a house officer in the Department of Anesthesiology, what is expected out of you while you're on duty as a house officer here, and the pathway to subspecialize or specialize in this field upon completion of housemanship training for those of you who are keen to join this field of medicine. Next, let's take a look at some resources for training which we have gathered for you to assist your learning while you undergo training as a house officer in this department. We have the Malaysian Society of Anaesthesiologists. The MSA, in short, is a professional association set up to promote the art and science of anesthesiology. It is a national body that coordinates the activities of anesthesiologists practicing in Malaysia. So, here, it aims to promote professionalism, cooperation, and friendship among anesthesiologists and are in liaison with similar bodies and specialties in other regions and in the international arena at large. Next, we have the Mitchell's Anesthetic Notes, which is a comprehensive set of revision notes by Dr. James Mitchell. It covers a large area of anesthesiology topics and provides practice questions to further enforce your learning. Then we have the Royal College of Anaesthetists, RCOA, which is a professional body responsible for the specialty throughout the UK, and this resource has training videos and modules on anesthesiology for your better understanding. And finally, the management protocol book, which is aimed at to facilitate clinicians in the management of critically ill. Each protocol was developed with careful consideration of current evidence as well as practical application and cost containment. The algorithms in these protocols are simple to use and can be easily implemented. Well, we have finally come to the end of this session. We hope it was insightful and thank you for your time.